so I've just been diagnosed with diabetes, and I'm not really sure what it's about.
Oh, well, thanks for telling me. Would you like me to break it down for you?
Yeah, it doesn't have sugar.
Yeah, it does. So basically, whenever we eat carbs, our body breaks down those carbs into glucose, which is a sugar. So that glucose then goes into the bloodstream, where our body will use it for energy. But in order for that glucose to enter our cell, we need we need to have insulin. So insulin is made in the pancreas. So the insulin acts like a key for like unlocking the cells, so the glucose can go inside of it and give our body energy, or we can like store it for later. This kind of helps like maintain that blood glucose levels in our body.
Okay, so what happens in diabetes?
So in type 2 diabetes, our cells don't respond properly to insulin. So even though we're producing like a lot of insulin, our glucose won't be able to get into the cell because the key doesn't work. So the glucose is basically just waiting around in the bloodstream, accumulating, which causes that high level of glucose. So over time, when that happens, you can produce like different kinds of symptoms. So you can, if you have type 2 diabetes, you can either feel like really sleepy because your cells are not producing enough energy to function, or you can have like frequent urination, trying to get rid of all that excess glucose. And that frequent urination can lead to like getting thirsty due to all that fluid loss. You can also feel like really hungry because your cells are craving for that energy from the glucose. And then you can have like weight loss because the glucose is not being used properly. And then you can have like blurry visions and like numbness in the hands and feet. You can have like wounds that are like very slow at healing, and you can have like vaginal infections as well. Um, some people do have like sexual issues because of the nerve and blood flow problems in their body.
Oh, I didn't know it affects so much.
Yeah, it does. But it also can cause like long term complications. You can have like eye problems due to that excess glucose. It like damages like the vessels in your retina, or you can have like heart disease due to like the buildup of plaque in the arteries, it causing like that thick blood. Or you can have kidney disease, the or you can have high high blood pressure, or neuropathy, which is like that nerve damage to your fingers and toes. So
Okay, so like, what causes it? Like, how did I get it?
well, there are a couple like risk factors to it. You can have, the big one is obesity, um, or people usually over the age of 40 have a higher risk to diabetes, or genetics. Genetics play like a big role in the in getting diabetes, because if you have it in the if it runs in the family, you have like a higher risk of it. And also not getting enough physical activity also causes diabetes. So
Okay, so what do I do?
well, um, there are like different treatments you can do. You can have like oral medication. This kind of helps with like your this helps your body respond to insulin a lot better. Or you can have like regular eating habits, or like watching your carbs when you eat. This helps like maintain that blood glucose levels in your body. Or you can like exercise. Exercise also helps your body respond to insulin a lot better. Or you can check your blood glucose levels often, so you know like where you're at, so you can like adjust to what like food you need to eat.
Okay, thanks for explaining.
Yeah, no problem.